Testicle?
That's a big testicle. They hit large cojones. I'm just saying. That's probably why they do the bull testicle, because they're already removing them anyway to make steers for food, and might as well put it to anatomy use, right?
That's what they do, sell all the parts and pieces.
Yeah.
So, bull testicle, we've got a few specimens here. This one's a little shriveled up, but it still shows the things we need. So typically the testicle would hang in the scrotum, kind of like it is now. So this thing that I'm holding on to at the top, and it literally kind of dangles like a pendulum in a way within the scrotum. This is the spermatocord. So that's kind of what I'm holding right now. Now there's a couple things in the spermatocord that you need to name besides, but the whole structure, and I'll word it in such a way that it's very clear what I'm asking for. The whole thing is the spermatocord. One of the things within the spermatocord that you would need to identify, I've teased away a little bit, and this, it was kind of all together here. So this tubule that has been teased away is the vas deferens. This is the beginning of the vas deferens. We saw the end of it in our other specimen where it ends up at the back of the prostate gland, but this is the beginning of it. This is the vas deferens, which is also incorporated into the spermatocord. Everything for the testicle comes through the spermatocord. There is no other connection to the body, the man's body, besides the spermatocord. There's a muscle in the spermatocord that you might need to know the name of. I would identify or ask to name the muscle, and it's very firm. You can feel it. I feel it. It's very firm and muscular-like. That muscle within the spermatocord is the cremaster muscle. Cremaster muscle is the muscle within the spermatocord. So again, read the card, read the question, and it will guide you to the appropriate answer. The cremaster muscle is used to elevate the testicles if they're cold, or it can let the testicles descend if they're warm. So the testicles are, sperm production for some reason doesn't really happen that well at body temperature. That's why the testes are not within the man's body cavity. They're kind of hanging outside of the cavity within the scrotum. The scrotum is about 2 degrees cooler than the body. And sperm production, if the sperm production's at body temperature, is only like 25% what it is 2 degrees less. So sperm production really curtails when the testicles are warm. So men interested in reproducing should avoid hot tubs and warm baths and tidy whities, things that keep the testicles warm or up near the body's heat. So if it's too hot, the testicles can get lower away from the heat. If it's too cold, like jumping in a lake, the testicles can be pulled up to keep them a little warmer by the cremaster muscle. There's also another muscle involved here, not here, but students often confuse it. There's a muscle within the wall of the scrotum. The scrotum typically is a wrinkly appearance due to the tone of the muscle. That also kind of has the same function of elevating or descending the testicles for temperature. That's called the dartos muscle. So keep your two muscles, keep them straight. I guess this is the testicle here, this wrinkly structure. It's perhaps shown a little better here. So the testicle is what most of this structure is. But then on the back, you can see this comma-shaped organ. So this structure here, it's kind of a lighter yellow. It kind of goes down the side, and then it has this little bumpy bottom. That's the epididymis. So here's the testicle. It's kind of wrinkly. I don't know why. Dehydrated probably. And then the epididymis, so it's on the back. It's like a comma shape, but it's on the back. So this would be the orientation. And so the testicle produces the sperm, and then the epididymis is where the sperm are stored until ejaculation. They can be stored there for something up to a month or maybe 6 weeks. It gets full. So if the sperm are not utilized, if they're not ejaculated, sperm production starts to slow down because there's no more room for them. They also can't swim so well after a while, and they're not very effective. So anyway, they're stored here in the epididymis. Then you might notice, so then the epididymis has the head is superior, the body is on the side, which is really the back side of the testy. So head of the epididymis, body of the epididymis, and then that little dollop-like tail of the epididymis. So the sperm are produced within the testicle, then they move into the head of the epididymis, and then as the days go on, more and more sperm are coming. Then the sperm pushed and are migrate to the body. Ultimately, they migrate to the tail. So the tail would have the oldest sperm, the head would have the youngest sperm. Ultimately, when they're ejaculated, you can kind of look here from the tail of the epididymis. It's a little squiggly, but then they're ejaculated out of the tail and the rest of the epididymis, but these are the first ones to go. And you see the tail of the epididymis is continuous with the vas deferens. These are all really a bunch of tubules. We already saw the testicle is a bunch of tubules. I don't know if you know this yet, but so is the epididymis. You can't really see it, but it's a bunch of tubules. Big, long, narrow, slender tubules. Ultimately, it kind of straightens out right here at the epididymis, and then this takes the sperm up into the man's body cavity during ejaculation. So, spermatic cord, vas deferens, the muscle in the spermatic cord is the cremaster muscle. The main player here, everybody, is the testicle itself. And then around the testicle, kind of in the back side here, the top, the back, and the bottom is the head, the body, and the tail of the epididymis. This outer membrane here, we'll jump to this one. And the reason I'm not using these is a number of reasons. The spermatocord has been cut very short, and you can really barely see it or appreciate it. Also, sometimes, like in this one, I don't know, the epididymis, there's the head, it's just kind of disjoint here. I don't know what happened, and you can't see the vas deferens very well. There's the tail. But anyway, this one seems to be intact, more intact with all the parts and pieces. So this outer layer of the testicle is tunica albuginea. It's a rather tough connective tissue layer. I think on this specimen I've teased it back a little bit. It doesn't come off easy, but it's pretty thick, it's pretty durable, it's pretty hardy. It's the tunica albuginea. Again, all of this is tunica albuginea. When you look inside of the testy, you see all of this spongy, kind of orange-looking tissue. Those are the seminiferous tubules, the very same thing that we saw on the slides earlier. Of course, that was at high power. So thousands of feet, thousands of meters of seminiferous tubules, all kind of folded up into lobes and lobules within the testicle. And they're constantly producing sperm during the man's just about his entire life, from puberty up through 70s, even into the 80s. As the sperm are produced, it curtails at around 50 or 60, starts to slow down, but unlike females, it never really stops, and it certainly doesn't stop kind of in a menopause kind of way, where, you know, everything's over, you know, there's no more sperm. There's always some, might get less and less as time goes by. So all the sperm are produced in this multitude of tubules, and they all kind of head towards that middle white area there. That middle white area is kind of where all the sperm end up, like the graduation ceremony or something. They all come here. This is called the reedy testy, and from the reedy testy they make their way out into the epididymis for storage. They're really not quite mature yet. You know, right here they're probably not ready to fertilize an egg. It does take a little bit of maturation, let's say, in the epididymis, but nonetheless most of the development occurs within the seminiferous tubules of the testicle. So all of this spongy kind of, and I don't know if you can see it's spongy. If you were to feel, you would know that it is spongy. Not to be confused with the spongy erectile tissue that we talked about in the penis. It just feels spongy. Really, it's just a bunch of very fine tubules that we saw earlier on the slides. Then the reedy testy is this white area, which is more tubules, kind of bigger tubules that all of these seminiferous tubules ultimately lead to. And then from the reedy testy, we go out of the testicle to the epididymis. The male reproductive system is really just a bunch of tubules. The ultimate big tubule is the urethra, and then it branches and branches and branches very much in that tree-like manner. We see all these structures, but if you were to straighten them all out, it'd just be a bunch of tubules. And glands. There's 3 glands along the sides of these tubules that contribute to the tubules, to the semen. We don't see them here, but as we discussed previously was the seminal gland, the prostate gland, and the Cowper's gland. So you can picture just like a tubule almost, fine tubules at the beginning, the seminiferous tubules, then they come together to the reedy testy, then they come together to the epididymis, and then the 2 epididymises, the left and the right, form a kind of more of a straight tubule, finally, the vas deferens. The 2 vas deferenses come along into the body cavity, around the back of the bladder, and plug into the back of the prostate, and both vas deferens come and connect to the urethra in the prostate. A lot goes on within the middle of the prostate, and then we get to, you know, the single tube of the urethra, which takes the sperm and the rest of the semen out of the body. It's very tubular, with glands, 3 sets, glands along the sideline. Glands make up about 95% of the semen, and then the testicles and the sperm make up about 5%. Did we cover everything on the sheet?
Just out of curiosity, what is that dark spotty part at the top of the testicle?
These
Is
are
that just
the-
something in a cow
They're
testes?
again
or-
ducts and ducts and tubules. I honestly don't know. It looks like it's part of the spermatocord because this is where the spermatocord would connect into.
Got it.
I
Okay.
honestly don't know.
Okay, might be a cow
exactly
thing.
what
Okay.
they
Thank you. I guess I should say a bull thing,
are.
not a cow. Sorry.
Anything you didn't see or you'd like to see again? Are you on a better point of view?
That's pretty cool.
Bull testicle. Okay, these will be the very ones on the practical next week. Just for a quick review, I had these